You feel a sudden sharp pain in your lower belly and your heart races. You Google your symptoms at midnight and convince yourself something is terribly wrong. Or maybe your baby hasn't moved in what feels like hours and panic sets in. Or you wake up from the most vivid, bizarre dream you've ever had and wonder if your pregnancy brain is broken. Here's the truth. Pregnancy comes with dozens of sensations that feel alarming, but are completely normal, and a few genuine warning signs that actually matter. If you're expecting or planning to be, hit subscribe. We're breaking down what's normal and what's not, so you can feel confident throughout your pregnancy. Every pregnant woman lives in this confusing space between is this fine and should I call my doctor? You're not overreacting, you're not being dramatic. And you're definitely not alone in feeling uncertain about what's happening in your body. Today, we're creating clarity. We'll walk through the common symptoms that feel scary, but are actually your body doing exactly what it should. The emotional and physical changes that are totally expected. And most importantly, the clear red flags that do require immediate medical attention. Let's start with those physical sensations that make your heart race, but are actually signs everything is working exactly as it should. Round ligament pain is probably the most common culprit here. It shows up as sudden, sharp pains in your lower abdomen or groin. Up to 70% of pregnant women experience this. It happens because the ligaments supporting your uterus are stretching rapidly as your baby grows. The sensation can be startling. It can literally stop you mid-step, but it's your body adapting to the enormous changes happening inside. The pain is brief, sharp, and typically triggered by movement like standing up quickly or changing positions. It's uncomfortable and sometimes alarming, but it's normal. Then there are Braxton Hicks contractions. These can actually start as early as 6 weeks, though you typically feel them in the second trimester. They create tightening sensations across your belly that mimic labor. Your whole abdomen might get hard for 30 to 60 seconds. The difference between Braxton Hicks and real labor is pattern and progression. Braxton Hicks are irregular. They don't get closer together. They don't increase in intensity. Real contractions follow a pattern, get stronger, and don't stop when you change positions or drink water. Braxton Hicks feel concerning because they mimic the real thing, but they're actually your uterus practicing for the main event. As your pregnancy progresses, you might experience rib pain, difficulty breathing, or intense pressure in your pelvis. This is your growing baby literally running out of room. Your uterus expands upward and puts pressure on your diaphragm, making deep breaths harder. Your baby pushes against your ribs. Everything gets crowded. These sensations are uncomfortable and sometimes make you feel like you can't catch your breath. But they're signs your body is adapting exactly as designed. Your baby is growing, your body is accommodating. It's supposed to feel this way. Now let's talk about baby movement, because this is where so much anxiety lives. And baby movement patterns vary enormously and change throughout your pregnancy. Before 28 weeks, irregular movement is completely normal. Your baby is small with plenty of room to swim around. You might feel kicks one day and nothing the next. That's expected. After 28 weeks, you should start noticing regular movement patterns. But here's what regular actually means. It means consistent for your baby, not matching anyone else's. Some babies are marathon dancers, others are chill and quiet. What matters is your baby's established pattern. If you're concerned about movement, try this. Drink something cold, lie on your left side, eat something sweet. These can all encourage your baby to move. The actual warning sign isn't less movement than yesterday. And it's a significant deviation from your baby's established pattern or no movement after you've deliberately tried to stimulate activity. If you usually feel 10 kicks in an hour and suddenly feel 2, that's different. If your typically active baby is quiet after you've had cold juice and changed positions, call your provider. Trust your maternal instinct here. If something feels genuinely off about your baby's movement, call without guilt. Your provider would rather reassure you than have you ignore a genuine concern. Let's address the emotional and mental changes, because pregnancy doesn't just transform your body, it fundamentally alters your brain chemistry. Mood swings, crying at commercials, sudden rage at minor inconveniences, intense anxiety. All of this is driven by progesterone and estrogen levels 50 times higher than normal. 50 times. Your hormones are creating a completely different neurological environment. You're not losing your mind. Your brain is being flooded with chemicals that affect mood regulation. Pregnancy brain is scientifically documented. Your gray matter temporarily decreases to make room for enhanced emotional processing and maternal bonding capabilities. Your brain is literally restructuring itself to prepare for motherhood. You might forget words, lose your keys, or walk into rooms with no idea why you're there. This isn't permanent cognitive decline. It's temporary neural reorganization that serves an evolutionary purpose. And those dreams. Up to 80% of pregnant women experience vivid, bizarre, even disturbing dreams. These happen because of hormonal changes, disrupted sleep cycles, and your subconscious processing the massive life transition ahead. You might dream about forgetting your baby, giving birth to animals, or scenarios that make no logical sense. These dreams can feel unsettling, but they're your mind working through fears, excitement, and change. These mental and emotional shifts feel destabilizing, but they represent your brain actively preparing for motherhood, not evidence that something is wrong with you. Your body is going to do strange things that seem random, but are actually well-documented pregnancy changes. 75% of pregnant women develop linea nigra, that dark line down your belly. It appears because of increased melanin production and typically fades after delivery. You might notice skin tags, changes in your moles, darkening freckles, or the mask of pregnancy across your face. All melanin related, all temporary. Your hair might become incredibly thick and glossy thanks to estrogen, or it might change texture entirely. You might develop carpal tunnel syndrome because of fluid retention putting pressure on nerves. Nosebleeds and bleeding gums happen because increased blood volume makes vessels more fragile. You might produce more saliva than seems humanly possible. Your feet might permanently increase a half size because relaxin loosens ligaments. Your vision might temporarily blur from fluid retention, changing the shape of your cornea. These changes feel random and sometimes concerning because nobody warns you about all of them, but they're documented, common, and usually resolve after delivery or breastfeeding. Your body is doing exactly what it's supposed to do, even when it feels weird. Now let's talk about discharge and bleeding, because this is where normal can quickly cross into concerning territory. Increased vaginal discharge, called leukorrhea, is completely normal during pregnancy. Your body produces more to protect against infection. It should be thin, white, or clear, and mild smelling. You might need to wear a liner daily. That's normal. Light spotting after sex or a cervical exam is also common because your cervix has increased blood flow and is more sensitive. A little pink or brown on the tissue after intercourse doesn't automatically mean danger. But here's where normal ends. Heavy bleeding that soaks a pad is never normal. Bright red bleeding with clots requires evaluation. Bleeding accompanied by severe cramping needs immediate assessment. Any bleeding in the third trimester should be checked right away. And brown or pink discharge is usually old blood and typically benign. But gushing fluid, even if you're nowhere near your due date, might be amniotic fluid and needs immediate evaluation. Your mucus plug releasing in late pregnancy is normal. But if it's coupled with contractions before 37 weeks, that needs assessment for preterm labor. Let me be very clear about the red flags that always warrant immediate attention. These are not wait-and-see situations. Severe abdominal pain that doesn't ease, especially if accompanied by shoulder pain or dizziness, could indicate ectopic pregnancy or placental abruption. Call immediately. Sudden severe headache. Vision changes, like seeing spots or flashing lights, or upper abdominal pain after 20 weeks could signal preeclampsia. This is a dangerous condition requiring urgent treatment. Don't wait on this. Fever above 100.4 degrees, painful urination or chills indicate possible infection that needs treatment. Sudden severe swelling of your hands, face, or legs, especially with a headache, needs same-day evaluation. Decreased fetal movement after 28 weeks, even after you've tried your kick count techniques, requires a call to your provider. And if you're having thoughts of harming yourself or your baby, please seek immediate mental health intervention. These are call your provider now or go to the emergency room scenarios. They're not in your head. They're not overreacting. They're genuine medical concerns. Here's the most powerful tool you have: understanding your personal normal. Every pregnancy is different, and your baseline matters more than any general guideline. And track your baby's movement patterns so you recognize what's typical for your baby and what represents change. Notice your usual energy levels. Pay attention to your normal discharge characteristics. Observe when your Braxton Hicks typically occur. This baseline helps you distinguish between different for me and different for everyone. Trust your instincts. You know your body better than anyone. If something feels genuinely off, even if you can't articulate exactly what it is, that matters. Good providers welcome questions. They would rather reassure you unnecessarily than have you ignore genuine warning signs. There is no such thing as calling too often or being too cautious during pregnancy. None. Your provider expects questions. They want you to reach out when you're uncertain. Pregnancy is inherently uncertain. Your body is doing things it's never done before. Sensations that would alarm you outside pregnancy might be completely normal now. Symptoms that seem minor might actually need evaluation. This isn't paranoia. It's the reality of carrying a growing human inside you. You're allowed to seek clarity and reassurance as often as you need it. Every question is valid. Every concern deserves acknowledgement. You're navigating 9 months of physical and emotional changes that range from uncomfortable to alarming. And you're doing it while your hormones convince you everything matters urgently. That's legitimately hard. But you're also building the capability to distinguish between sensations you can monitor at home and those requiring medical attention. You're learning your body's new patterns. You're developing confidence in your maternal instinct. That knowledge is power. It reduces anxiety while maintaining appropriate vigilance. You're not overreacting when you Google symptoms at midnight. You're gathering information. You're not being dramatic when you call your provider about decreased movement. You're being appropriately attentive to your baby. You're not broken when pregnancy brain makes you forget basic words. Your brain is restructuring for motherhood. Give yourself permission to feel uncertain and to seek reassurance without guilt. This journey requires you to trust your body while also staying alert to genuine concerns. That balance is challenging, but you're absolutely capable of it. You're doing better than you think you are.